Some things I would want to emphasize for members of the community. One is that a lot of patients seem to have a fatalism about stroke, that it just happens by chance, that maybe it's happened to a mom or a dad or a relative. Because it comes on so suddenly, it feels like it comes out of nowhere. And I just want to emphasize that according to the best data we have, something like 80% of strokes are preventable, which is to say, if we all ate like we should and stayed active like we should and took our blood pressure medicine like we should and stopped smoking, et cetera, stroke is not nearly as random as it feels. And so sitting at home right now, you can make changes to your life to dramatically reduce your risk of stroke. Another thing I'd emphasize is that being a primary stroke center here in Cookeville, we can do everything to treat the great majority of strokes. And so over 90% of patients who come here with a stroke are able to stay here, get all their care here. And I feel comfortable saying, having trained in a big center in a big city, that patients here get essentially equivalent care to what they would get in the big city. One of the things that's been most rewarding about establishing a stroke center here is seeing the way it's affected our community. And the very first cases where that really came home was treating family members of staff members here in the hospital. And so I think of one of the very first ones, family member of one of our emergency department staff who came in with what was going to be a really devastating stroke, likely a fatal stroke. All the processes we had been working on for years in the emergency department just went perfectly. She got the optimal treatment really quickly. 2 days later, walked out of the hospital with no deficits or no neurological injury at all. And it's cases like that that are just so thrilling and make it worth the sort of day-to-day difficulties of doing what we do.